Okay, so let's jump on in and we're going to start with the head, neck, and upper extremity portion of this skills validation. So first, I'm going to perform my hand hygiene and I'm going to introduce myself to my patient. Hi, Dale. My name is Caitlin. I am a nurse here and I am going to be performing a brief head to toe assessment. I have already described the procedure to both Dale and his mother. I've obtained consent from his mother. Dale, do you or your mom have any questions before we begin? No? Great. Okay. So first, I'm going to start out by identifying my patient. So can you please tell me your full name and date of birth? Dale Davis, 10/25/15. Dale, do you know what day it is today? It is 10/25. Happy birthday. So I've established that my patient is alert. He's oriented to person, to time. Dale, do you know where we are today? Correct. We are in the hospital. And do you know what we're doing here today? We are performing a physical assessment. Great. So my patient is now also alert to place and situation. So all in all, I can say my patient Dale is alert and oriented to person, place, time, and situation. I've identified my patient. I've established that he is alert and oriented. So now I'm going to go ahead and start with the head and neck portion of my assessment. In doing this, I am first inspecting for symmetry. I don't see any cuts or bruises or lumps or bumps. I am comparing side to side. I'm looking at his eyes and his ears. I can tell you that in my inspection, his eyes and ears are symmetrical, but I am going to go ahead and don my clean gloves before I start palpating, just in case. Please note that this is not on the rubric. You don't have to palpate the head. It is a typical piece of that assessment. So if you are going to do it for your video submission, please don gloves. So I am palpating. Dale, any pain or discomfort? No. Perfect. I don't feel any swollen lymph nodes. No open wounds or drainage. Off my gloves. Anytime you take off your gloves, you're going to want to make sure to perform hand hygiene again. So I have symmetrical eyes, symmetrical ears. So I'm going to go ahead and take a better peek at both ears. Just walk over and do on this side. Perfect. So Dale, I am going to test your pupils, okay? So this is where you're going to want to dim the lights if you're able. If not, you're just going to want to cover one eye at a time before you expose it to the pen light. So I'm going to start over here. Perfect. Do it over here. Awesome. So that I would now say that Dale, his pupils are equal. They are round and reactive to light. Now I'm going to test for accommodation. So I'm going to have Dale stare at my pen light here. As I get closer to him, I would expect to see those pupils constrict. And as that pen moves away, you can see that dilation of the pupils. So now I can say his pupils are equal, round, reactive to light, and to accommodation. All normal findings. Now I'm going to move on to the oral cavity. So this is where you're going to have your patient open their mouth and inspect. So I see nice pink tongue, pink lips, moist mucous membranes. Teeth are intact. No broken teeth or issues there. Now we're going to move on to the upper extremities. So I usually start by inspection. Again, I don't see any cuts, scrapes, bruises, freckles, nothing. The skin looks fine. I'm going to feel the temperature. So the skin feels warm and dry. I'm going to check both radial pulses simultaneously, noting whether or not they're equal and their strength. So I would say These are +2 strong bilateral radial pulses, and they are equal in rhythm and strength. Now I'm going to move on down here. I'm going to check capillary refill in the fingertips, noting that brisk return of color, which is a normal finding. I'll do the same over here. Great. Nice brisk capillary refill. Now I'm going to have my patient pinch both of my fingertips. So I'm going to give him 2 fingers and ask him to squeeze to test strength. So that's a good strength. And then I'm going to have him push towards him and away. Great. So that is good strength against resistance as well. So having them perform those range of motion exercises at the same time as assessing their strength is a nice way to do it. What I like to remember is CMST. So we've already assessed circulation, we've assessed movement, we've assessed temperature. That S, that CMST, that S is sensation. So at this point, I'm going to have my patient close their eyes. And Dale, I'm going to want you to tell me which hand and location you feel my touch. So right index finger, great. Left ring finger, and you can't see that, perfect. So make sure when you're assessing sensation that you are assessing at the distal portion of the extremity, okay? So not up here, but down here. Another thing that I might have done in this portion is assess for skin turgor. Again, if we forget to do it here, we can always come back and add it into another portion of the assessment. But at that point, I'm going to come up to the chest or the forehead if you were doing it earlier, and you're going to squeeze, noting the patient has any dehydration or tempting, which Dale does not. So skin turgor is normal. So that'll conclude the head, neck, and upper extremity portion of the exam. Again, it takes less than 5 minutes. Read that rubric, make sure you have everything covered, and then we're going to go through the other portions. But if this were the end of my assessment, I would make sure to perform hand hygiene and clean my equipment before I moved on.